understand how they feel. So I think you raise a very important point. And if I was you, I would suggest you write a letter to the Ministerial Advisory Committee and say that you've spoken to Professor Glenda Gray, and she has suggested that it's time that children had a voice and had a right to hear, to listen, and to ask questions, and to be part of the decision making around their future. So it's very important that you've raised this point, and now that you've raised it, it's our job to make sure that we implement your suggestions, because it's very important. Children are very important. You are our future leaders, and we have to groom you and get you to learn your voice so that you are able to take over when you become adults.
Thanks, Professor. I see we're now also live streaming on YouTube, and I'm sure that that will be available through our social network sites, again, Facebook, Twitter, and Instagram at Oryx Radio SA, that can be found. But now continuing with the discussion around children, we'll get back to that in a little bit, but we're now going to have a look at the different issues that have been raised in general over the past few weeks as South Africa has moved from level 5 down to level 2, and the number of cases have also been, the number of new cases have begun to decline. And it seems that as a country, with our response, we have begun to move in the right direction. So we've got some questions around this, and Osama is going to start us off with question number 5 relating to this.
Hi, Professor. We are number 5 in the world in terms of cases, and people are worried that the number of cases might increase, and there are not enough testing being done. Why have we got into level 2?
So that's a very great question. So I think at the beginning of the epidemic, there was a global shortage, a worldwide shortage of tests. And so all the countries were competing to try and get the materials to test. And when we went to level 5 lockdown, that meant that we also closed down our international airports, which impacted on our ability to bring the tests in. So during lockdown, we slowly increased our ability to test. And in South Africa, we now have the largest testing program in Africa, but still that is not enough. So we need to continue to test. It's very hard to use tests as an indication of how bad or how good your epidemic is. So testing just gives us a small flavor of the epidemic in our country, and we have to use other ways of trying to understand how our epidemic is unfolding. We can do tests where we can test members of the community called seroprevalence surveys, where we can look for presence of antibodies to see if you've been exposed before. So that's one way of looking at how the epidemic has progressed. Looking at how many people get admitted to hospital, looking at how many people die are an important indicator of the epidemic. And so South Africa did have a rapid increase in infections. And we remember, I think all of us remember, in June and July, how horrible it was when all the hospitals were full and we were hearing that we were running out of oxygen. But luckily at this moment in time, we've over the peak, and we now are what I would call an endemic phase of the epidemic. And this is where the community transmission continues, and we continue to have, we can't eradicate the virus, but we continue to have onward infections. And how bad the epidemic gets now after our peak depends upon us. So if we continue to have to use masks, wash our hands, and keep our distance from people, if we continue to have well-ventilated areas, if we continue to avoid congestion and crowds, we can prevent another surge, and we can prevent our epidemic getting out of control in South Africa.
Professor, I also have another follow-up question. What influences does the numbers have on justifying us moving into level 2? Are there any other things that you have taken into account?
So we have to take a lot of things into account. So besides the testing, we also have to think of other ways of testing. So at this moment in time, because we had a shortage of tests and because we had a surge, we could only test healthcare workers and people who were symptomatic, who were in hospital. So we had to save our tests for them. And the other ways we can manage our the epidemic is to look at other ways of seeing where the epidemic is going. And so there is research being done on whether we can use wastewater or sewage systems to look for the presence of virus in there to predict new outbreaks. We also now in South Africa have to move to a different testing strategy where we can make sure we start to test more members of the community, maybe test children at school, test teachers and other people to see how the epidemic is evolving in those areas of society.
Thanks, Professor. One of the things to do with tests has been one of the issues raised is exactly who is able to be tested and who can be tested. So Malika has a question with this, with question number 6.
Professor, it was reported that any persons under the age of 55 would not be tested unless they have an underlying illness. So my question is, why were the youth, or particularly students in high schools, as we were the first group to return back to school, not tested? We are the future leaders and we will be taking over from you guys one day. So surely we should be protected at all costs. And would the lack of testing provide us with accurate figures about our statistics in South Africa?
So that's a very good question, and it leads us to the question about why do we test? So the first reason why we test is to manage ill people. And so we know a large amount of people will be asymptomatic with this disease, or you might not even know. And the people who are over 55 are more likely to be symptomatic and maybe more likely to need hospital or other care. And so when we had a very little amount of tests and we had to rationalize our testing, we had to say, who are the people that need the test more? And the people that needed the test more, or the people that needed to go into hospital or may have an adverse outcome from the disease. They may be old, they may have hypertension, diabetes, HIV or TB. And so those are the people we needed to know who was SARS-CoV positive. And we also needed to know for our healthcare workers who were positive, because we couldn't allow healthcare workers who had SARS-CoV to continue to render care in the hospital. And so when there was a shortage of tests, we had to rationalize the test, and we had to test people who would have the worst outcome from the infection, and also test healthcare workers, because we couldn't allow infectious healthcare workers to carry on working in hospitals and clinics. And so that's why we chose people over 55, because we knew those were the people that we needed to manage and who may need to go to hospital. We didn't rationalize testing for children at school or for young people, because even if they had a symptomatic disease, they were less likely to get very ill or be symptomatic from it. And also from international data, we also knew that younger school children were less likely to spread the virus as compared to older teenagers and young adults. And so the importance of testing at that stage was to manage people who were sick and to manage healthcare workers. As you move into different phases of the epidemic, you can start doing other kinds of testing, and depending on what your strategy is, you will then decide who to test. And so we didn't test children and young adults, because we knew that it is very unlikely that these young children or adults or teenagers would do badly from the infection. At another stage of the infection, at another stage of the epidemic, it may be important to know which young children, adults, and teenagers have the virus, because you can help then prevent the onward propagation of it. To test young people would also have maybe been problematic. We know that SARS-CoV-2 or COVID-19 infection stigmatizes people. I know some people who got infected in June or July this year, and they're still stigmatized. They're still stigmatized at school, and they're still stigmatized at their workplace. And so we also have to make sure that if we do testing, the testing doesn't lead to stigmatization, discrimination or anything that impairs your ability to learn and to be able to contribute in a meaningful way in society. So that's very important. So knowing your status would be helpful because it'll help you prevent the onward transmission of the virus. But also at the same time, when there's a shortage of tests, one then chooses to test those people who will benefit the most at that stage of the epidemic from the tests.
Thanks, Professor. Thank you so much for that. We've got something to tie in then now a bit to that stigmatization is Sunwabo's question here, which is question number 7.
Professor, with the pandemic, many people are afraid of going to the hospitals. They are worried that with the pandemic, many people are afraid of going to the hospitals. They are worried that the hospitals might be too busy or that the resources are focused on COVID-19. Will they be treated differently because of the COVID-19 pandemic?
Yes, so what you say is true. When the COVID-19 epidemic broke out in South Africa, a lot of the health services were reorientated to support people who were COVID infected and who needed care. And people then became scared to go to the hospitals. They became scared because they thought if they went to the hospitals, they would get COVID-19. And so what we did see was that moms were too scared to take their children to get vaccinated. We also saw that pregnant women were also too scared to go and get antenatal care because they were scared they were going to get COVID-19. And we also saw people who needed chronic medications, so people who needed medicines for diabetes, hypertension, HIV, and TB. They didn't go to the hospitals because they were scared. So in the future, and if we have another pandemic again, we have to make sure that our health system is resourceful enough or resilient enough to manage both COVID-19 or the new virus, as well as making sure that the current health system is maintained and that we don't deprive other people from getting their care because everyone is scared of getting COVID in the hospital. But at the same time, we also have to make sure that our hospitals are fit to manage COVID-19 and that we have all the resources like oxygen and nursing care to make sure that people who have got COVID get the right care. And more importantly, also, we have to make sure that we don't discriminate people in the hospitals and who are COVID positive, and we treat them as humanely as possible, because we do know that sometimes people are ostracized if they have COVID-19.
Thanks, Professor. Following on these concerns that have been voiced, we do know that a lot of issues are raised from baseless information, misconceptions, or simply fake facts. So we've got some questions surrounding this, and Tariq has a question for you with question number 8.
Thank you, Alex. So, Professor, during the outbreak of this pandemic, we have been given a lot of advice, and this has either been spread by a word of mouth or through different media platforms and social media platforms. And at many times, this advice that we have been given tends to contradict one another, because some of them can be good advice that is quite useful, and some of them can be advice that tends to make the situation worse. So, as you said earlier, the wearing of face masks, sanitizing our hands, but then we were also told that the virus can be spread through saliva droplets in the air and that the virus is airborne. And at some ridiculous point, I don't know who came up with this, but we were told that we had to drink bleach to cure the virus. And for those that have been infected, we were told that the facilities that are meant to contain these people with COVID-19 were full and could not withhold more people with COVID-19. So my question is, how do we identify what is real news that we should actually consider and what is fake news, and how do we go about stopping the spread of incorrect information?
Yeah, so that's very important, the difference between fake news and information that changes over time. So yes, it is true that in the beginning, as I said, this epidemic is very young. It's only been with us since December last year, and so we're learning all the time. And so the issue of how the virus is spread became evident when we started to see cases of COVID-19 being infected, people being infected in closed areas, people being infected from singing and people being infected in restaurants when there was movement of air, and began to see that this could also be spread not only via droplet, but also by airborne transmission. And that was a very important scientific finding, because it helped us understand the importance of ventilation and to make sure that we started to avoid crowded conditions and congestion, and to limit our interaction with people because of the issue of airborne transmission. And so as science understands the virus more, and as we gather more data about how transmission occurs, new information will arise, which may either replace the current information or disprove the current information, much like we heard about the reinfection, that we didn't think people could get reinfected, and in fact we've been proven wrong with this. And now we will have to understand the immune response and the immune system. And so there are things that are logical, like airborne transmission and droplet transmission, but there are things that are not logical, like drinking bleach. And we all know that if you drink bleach, you can get very sick and you can die. And so we also have to trust our own instincts about things. Some things, just sound crazy, and we know that is false. That would harm us if we had to drink weird concoctions to protect us. But things like this, but things like the immune system, and will change, and we'll learn new things all the time. We also have to be careful about claims. We have heard claims even from Donald Trump about medicines that work. So even presidents can spread fake news, and so we have to be careful about key opinion leaders saying things, particularly when they're not scientists. And we have to always make sure that science is protected. So we can't have presidents of countries saying, "Oh, we're going to rush to register this drug or rush to make this vaccine available without the right data," because we have to first of all do no harm and make sure that whatever we put into people is safe, and that the information we get is reliable and reproducible. So that's a very important thing. And I guess with an epidemic like this, there's always going to be a lot of hype and a lot of hysteria, and we have to try and distill fact from fiction. And I think the important thing about fake news is to continue to see what if it's verifiable. So very quickly, when fake news comes out, we do see people talking about this is wrong, or this is right, or we agree or we disagree, and then always then to look for the science. So and to look at the science, rather look at the data before we make conclusions about certain things. So it's a very important thing. And there will be lots of conspiracy theories. I've heard conspiracy theories as well as lots of claims for cure that are incorrect.
Thanks, Professor. And now moving on, I think, to the thing that sets this webinar apart today is that it's being hosted by children, specifically children who have conditions or are at least familiar with healthcare and being in hospital through RX Radio. So we're going to go through some questions relating to children. Specifically, we'll also involve some of the children with giving their opinions and voices, and Talita will be helping me with that. So we're going to start with Tamina, and the first question, number 9 in this section.
Professor, many of us children with and without health conditions have been at home for the past 5 months, and we have lost a lot of education, and this made us feel worried and anxious about our education and the future. A lot of people talk about virtual education, but some of us don't have the money for the data, and some of us don't even have internet. Some people, I'm not being rude, but in poor conditions don't have the necessary caregivers that have the skills to homeschool them. But we all have the right to education. What do you think should be done to help this and help the children solve this problem?
Yeah, you're so right. Children have had so much collateral damage from this epidemic. So although you've been spared from the disease largely, you've been out of school, and you've also been having to stay at home, and you also have been affected by not having enough nutrition, and by your family and your family members losing employment and making households much poorer. And the poorer households become, the more it affects children. So children really have borne the brunt of this epidemic. And they've borne the brunt of this epidemic both in South Africa, in America, and in Europe, and in Asia. So wherever you are in the world, children have been severely affected by this, and particularly their schooling has been affected. And a lot of children all over the world have not gone to school for months on end and have not had access to internet and remote learning. And I think maybe the lesson for us going forward is to pay attention to issues of innovation, the fourth industrial revolution, bandwidth, connectivity. We all live we all have the right, wherever we are in the world, to have access to the best data, which should be free and available to everybody. And the questions we should be asking is how do we innovate to make sure that education continues even in a disaster, and that wherever we are in the world, children have the right to the best education. First of all, hopefully face to face, and if not face to face, in ways that maximize your learning. We know a lot of children got depressed during this lockdown. They were very sad. A lot of children feel they're going to die, and they have nightmares about this. And so we haven't paid a lot of attention to the mental health and the education context of the child, and that is very bad. And it's very important for children to point out to us. There were surveys done in South Africa that showed that children were not getting enough meals, that children were getting depressed, and that children were going hungry, and that they were not getting the proper education. And so we have to make sure in the post-epidemic world that we live in, particularly in South Africa, is that we make our schooling more resilient, and we make a better effort to protect our children and our families and prevent them from being the most vulnerable part of the epidemic. And so the important lesson for us is to learn from this, learn why, we were unable to open up schools fast, learn why, what we have to do to improve connectivity for poor kids, learn how to improve systems to get food to people, and learn how to improve our way of supporting families who need money in terms of social grants and the COVID social grants. And so we have a lot of work to do, and there has to be a lot of improvement, and you have to hold us to it. You, after this epidemic is gone, you need to hold South Africa and adults in South Africa to making sure that we protect all parts of being a child. And that's the part of a child to learn, the part of the child to feel safe in their home, and the part of the child not to go hungry. And so you need to make sure that we deliver on that in the post-COVID world that we have.
Thanks, Professor. I'm going to ask Talita if she can just ask a couple of the reporters to share how they felt during the pandemic. So over to you, Talita.
So, Nurunisha, I want to ask, because of the COVID, how did you feel that you're not allowed to go to school anymore and you'll be at home doing the same thing, that's eat, sleep, do whatever, and sleep again? So how was your experience, and how did you keep yourself busy?
I kept myself busy. I did the pack that my teacher gave for work. I did my blue books. I played on my phone. I watched movies, and I talked to my sisters.
Great, thank you for that.
Thanks, guys. So I think question number 10 that we did have what has been kind of answered by the professor already. And just seeing as we've got about 15 minutes left, we're going to move on to question number 11. So we'll stay with you, Nuru. You can ask question number 11. You were talking about how you've been at home and doing your schoolwork at home. Also know that you've been missing your friends. So you can put that question forward.
I know all the golden rules.
But you're talking so softly, I can't hear you. Maybe I'm getting old and deaf.
I know all the golden rules and that we have to physically distance, but I have been missing my friends. When I go to school, will I be able to play with them?
So that's a very good question. Okay, and so when you go back to school, the first thing you will do is you'll be wearing a mask and you'll be washing your hands very often, and your desks will be more than 1 meters apart from your other desk, from 1 meter to 1.5 meters. And when you go outside, you will be able to play with your friends, but you won't be able to make close contact with them. So you need to still keep your distance. Make sure that you play in wide open spaces, and make sure that you don't make close contact. And so you can play sports, but sports that don't have close contact. If you like skipping, you can still skip with your friends. If you like playing soccer, you can play soccer with your friends as long as there's not contact, and you wash the ball afterwards. And the most important thing always to remember is to, after playing, is to wash the balls that you're playing with, and to wash your hands, and make sure that you do try and keep space. People who spend a lot of time together, close contacts, more than 15 minutes, should not be too close, and you must remember to try and keep your distance, which means you're going to have to learn how to scream so we can hear you through your masks, and you're going to have to learn how to use your face, use your hands much more, because often we use our mouth a lot to express things, and so that can be very hard for children who are deaf. And so maybe shields is important for some children who have special needs, because they need to see your facial expressions. But remember that shields have to be right over your face, cover your chin if you use them a lot.
Thanks, Professor. And we're going to stick with the theme of talking about children and looking a bit more now at the emotional side of it. And Blessed is going to ask us question number 12, which has to do with this.
Is there any plan for children who have lost their parents or caregivers due to COVID-19?
Okay, so for those who never heard what Blessed said, Blessed asks, for those parents and caregivers who died from COVID, what is going to happen to the families? Is there going to be any support? And he's very concerned about the lack of support for families. So that's a very important question, and I think the first thing we have to do is try and understand how many families like this are affected. And first of all, it's important to know how many families are affected like this, and what is the composition of the family, and what are the support structures of the family. And then depending on how desperate the family is, whether it's just children left, we have to get social workers involved, and psychological and mental health services involved, to try and first of all stabilize the family from a mental health point of view. And then from a financial support view, we're going to have to make sure that families access relief grants and COVID grants, and also that the children in households are on child grants. And so it's very important, if there are any families that find themselves devastated by the deaths of their loved ones, is to come forward, so that the social services and the health department can support these families and make sure that they are protected. So that's a very important question, and people may not know how to reach out, but it's very important that whoever is in this situation, found themselves desperate from the death of their loved ones, is that they contact the social services department to get support and relief. That's very important. Even NGOs, Gift of the Givers, and other NGOs, if any of you know NGOs in your area and you know families, it's important that the families are connected to NGOs that can help them. And one of the best NGOs is Gift of the Givers, and they can also help facilitate that. In Cape Town, MSF can help, and so any NGO will be important in trying to make sure that these families are supported and are helped to navigate access to resources. It's a very important question.
Thank you, Professor. We've got just under 10 minutes to go, so we're going to move to our last couple of questions. And with these, we want to look at the broader impacts of the virus as well as the future. And so I'm going to start us off with Talita for question number 4.
Sorry. So, Prof, we know that you've been working with vaccines and many other countries are doing the same. But why is it so difficult to develop a vaccine? And once this vaccine is developed, would everyone across the country have access to it, especially those who don't have access to quality healthcare?
So that's a very important question, and Talita, you also obviously are listening to the news, because there's lots of discussion on this at a global level. Everybody's asking this question because of vaccine nationalism. So why does it take so long to find a vaccine? So normally under a non-disaster pandemic situations, it can take up to 10 years to find a vaccine. So first of all, you have to develop your vaccine platform. You have to test it in animals to make sure it's safe. Then you have to have an animal model to prove that it can protect against infection. And then you start to do your trials in humans, in adults first, and you make sure that you understand the dose, how safe the vaccine is, and what the immune response is. And that can take 10 years because pharmaceutical companies don't want to waste any money in case the vaccine doesn't work. And so in an epidemic or in a pandemic or in a disaster, you have to take 10 years and put it into 10 months to find that vaccine. So luckily for us, we know the structure of coronavirus, and we know that the spike protein is a very important part of the virus that we can use as a immunogen to make an immune response to. And luckily for us, we have lots of vaccine platforms that we've been using to make HIV vaccines, to make Ebola vaccines, to make Zika vaccines. And we've used these platforms and we've put these new antigens in from the coronavirus and put them in. So we have a lot of information on the safety of these vaccines, and putting in a new antigen or immunogen from the virus helps us understand whether the vaccine platform will give us a good immune response. And so we've accelerated vaccine development based on the fact that we do know a little bit to a lot about the platforms that we're going to be using. And we've been doing a lot of the vaccine trials in parallel together, so that we don't have to wait and do them sequentially. And so there are about 4 big trials that are happening at the moment, and we hope that these trials will have a signal early next year. But then still, we need more data to make sure that we know how long these vaccines last for, how long the immune response is. And so we hope to have a vaccine to be registered towards the middle to end of next year. Who should get it? And that's a wonderful question. And so I think the first people that should get it are the old and vulnerable. So those people who are more likely to die or get very sick from the virus should get the vaccine first. The next group of people who I think should get the vaccine first are essential services. So those nurses and doctors and porters and lab people and all those people who have to interface with the public all the time, particularly who have to take care of them, they should get it. I think teachers, taxi drivers, and people who work in home affairs and everybody who interfaces with the public all the time should get it. I think that hopefully there'll be enough for all of us to get it. But you obviously want to start off step by step, and then eventually everybody can get it. But if you only, in the first instance, you have to give it out to the most vulnerable and the elderly first, and and the people who are going to benefit the most from a vaccine. And then eventually, we also need data on children. And so obviously children need to get the vaccine, but first of all, we need to make sure that it's safe in children. And so we will have to start doing studies in children, and we're already starting to talk about that, starting to say, okay, how would a study look like in children, and when should we start doing those studies? So a lot of people say we should only start doing studies in children once we know it works in adults. And we'll know it works in adults hopefully early next year. And then we can start looking at how it works in children. A lot of people say, well, what about pregnant women? And then we have to make sure that it's safe in pregnant women and in women who breastfeed and people that are more vulnerable. We also want to make sure that it's safe and works well in HIV infected people and people with other infections. The important thing about this vaccine, we need to know that it works with people who have chronic diseases. So people with hypertension, diabetes, we want to make sure it works well in everybody so that it's safe to roll out and effective as well. So that's a good question, and hopefully all these vaccines are going to work. Because if all these vaccines are going to work, that means lots of people will make billions of doses. And if more than one vaccine works, hopefully it'll also be cheaper. Because if 5 vaccines work, then there are 5 people that that you can negotiate prices with. So it's my dream that all the vaccines that are being worked on at this moment will be successful.
Thanks, Professor. I think we've got time for just about 2 more questions, so we'll try and get to them quickly for Amira and Nasira, who both haven't asked the question yet. So going with Amira first with question number 16.
So with the lockdown, Professor, women and children could be trapped in difficult situations with their abusers. They were unable to leave their homes, buy airtime, get money or tools to call for help, and etc. How can we help women and children raise their voice during this pandemic?
Yes, it's true. We know that gender-based violence and violence against children is an important thing that happens in our country and happens amongst our women. And we did see an increase in gender-based violence and violence against children. And this obviously we need to deal with in many ways. And so we have to change the way society thinks about women and how society values children. And we need to make sure that we have different mechanisms to protect women and children. And so again, we need to work a lot more in interventions and delivering interventions to protect women and children. And it is true that women were vulnerable and children were vulnerable, and that some women and children had terrible experiences during lockdown. Lockdown caused a lot of anxiety. People lost their money. Families were hungry, and increased stress in the household. And when you have increased stress in the household, often that is accompanied by violence, particularly if people are also abusing alcohol. And so we need to do a lot more work in this country on that. And certainly not enough work is being done, and we need to concentrate on that in the post-pandemic South Africa.
Thanks, Professor. And then finally, Nasira with the last question.
Many of us children and youth in South Africa feel that because of the pandemic, we are going to be perceived as a lost generation and not able to get jobs. How then can the future for me and the rest of South Africa's children be secure?
So that's a beautiful question, and I think you need to, Wayne, we need to get it to Alex. We need to get it to repeat it again, because I think everybody needs to hear what she said. So I think, can you just help it? Because I think we mustn't lose this beautiful question.
Many of us children and youth in South Africa feel that because of the pandemic, we are going to be perceived as a lost generation and not able to get jobs. How then can the future for me and the rest of South Africa's children be secure?
Okay, so I think you heard that, and it's very important that we don't want any child to be part of a lost generation. And we don't want any child to lose out of their education or on the opportunities for the future because of COVID-19. And it's our job as South Africans, and it's our job as society, and it's our job as children and children advocates to make sure that no child loses his or her future because of COVID-19. And we have to make sure as South Africans that no child is a lost generation because of this. So we're going to have to catch up school, and we're going to have to make sure that children get food, get their food parcels, and we're going to have to make sure that we concentrate on making sure that no child is left behind because of COVID-19. And we all have to promise that as South Africans. And so thank you for that important question, and it helps us, and it must be our mantra going forward, that there is say no to a lost generation and say no to letting any child be left behind because of COVID-19.
Well, everyone, and Professor Gray, thank you so much for joining us this morning. The hour's flown by. It's been an incredible hour learning about all the different impacts that COVID-19 has had and how the government response has panned out. So on behalf of RX Radio and also Citizens in Solidarity Behavioral Change Campaign, thank you to everyone who's joined us and watched. If you want to join the conversation, please remember on social media, Twitter, Facebook, and Instagram at RX Radio SA is where you can find us. And please use the hashtags Children's Voices, hashtag RX Radio, and hashtag Solidarity. This has also been streamed live on YouTube. So if you want to go back, want to watch any parts, you'll be able to do that. And again, you can check through our social media platforms for those links. So thank you so much, everybody, for joining us. And thanks to all the reporters for being on. And Professor, thank you so much for joining us today to answer all the questions.
Thank you.